Welcome to our Mother's Health podcast. And this is a podcast where we shed light on real stories behind maternal health statistics. In today's episode, we are going to be looking at or discussing when surgery goes wrong. We're going to explore the devastating consequence of mismanaged Caesarean sections, from preventable complications to lifelong trauma. So that's our topic. In the previous episodes, we discussed the delays, the 3D delays in healthcare. And one of the third delays in treatment is delays in receiving adequate care, which is caused majorly by understaffed facilities, lack of supplies, and mismanagement in healthcare. Many women are at risk, especially in African countries, and evidence from 22 African countries suggests that maternal deaths after CS are 15 times higher than in richer countries or developed countries. And this is largely due to the hemorrhage, sepsis, anesthesia problems, which are highly preventable with the right system. Within Africa, reports rates range from 3 to 11 deaths per 1,000 C-sections, showing facility to facility variations, as you can imagine, in most of these reports. Caesarean section is meant to be a life-saving surgical procedure, but when mismanaged, it can cause severe harm. And common issues include poor surgical techniques, lack of sterilization, delayed post-operative care and low resource settings, poor training, inadequate supply, and of course, medication. We see all the complications are the result of all of these neglect and issues with mismanagement. I'm going to bring to light two stories. One is Grace's story from Kenya. These are devastating stories and heartbreaking stories because a C-section, like I said before, is meant to save life, not meant to leave long-term chronic issues and pains and complications and even mortality. Grace, 28 years old, underwent a cesarean section in a rural hospital. And the surgical wounds became infected due to non-sterile instruments. And she then required multiple follow-up surgeries and then lived with so much chronic pain. Another story also is Fatima's loss in Nigeria. Fatima's C-section was delayed for hours. One, because of lack of blood supply, non-functioning theater. Her baby died shortly after, and she developed sepsis. And these are preventable measures to be taken to address all of these delays and mismanagement within the healthcare facilities. So I'm here with a very special guest. Very hard to track down this very special guest, very advanced in his practice. And with me here is Dr. Ajadi. He's a consultant obstetrician, gynecologist, and minimal access surgeon, with over 2 decades of excellent practice and service delivery in both public and private sectors. He has also held many leadership positions in and out of clinical practice. He is the medical director of Royal Care Medical Specialist Clinic in Port Harcourt, Nigeria. He's happily married with 3 lovely children. And I'm just going to welcome you again, Mr. Ajadi, to the podcast. It's an honor to have you here with me today. I'm delighted to have you on the podcast.
Thank you, Vivian, for having me. And it's a pleasure to be here to discuss this very important topic.
Yes, thank you, Mr. Ajadi. So we'll proceed into the discussion around this mismanagement of C-section in hospitals all over the world, in developing countries especially. This is more predominant in developing countries. What is this issue about, Dr. Ajadi, the mismanagement of Caesarean section? What are your experiences with these? Can you tell us a little bit about it? How does it go wrong? This is supposed to be a straightforward procedure. How does it go wrong?
Okay, we all know that. Thank you for that question. We all know that C-section is a life-saving procedure. carried out on a pregnant woman to intervene and expedite the delivery of a baby, either to save the life of the baby or the life of the mother or both of them. However, in many developing countries, we have different things that can lead to mismanagement and poor outcome ultimately for the mother as well as for the baby. And some of the factors that are very common include poor surgical technique, because in many underserved areas, you have people who are not properly trained engaging in this interventional surgery. And also you have conditions that many times can predispose the patient to sepsis infection after the surgery. These are factors that many times leads to mismanagement, poor surgical technique, infections, and use of unsterilized equipment. And these are also coupled with other factors like non-availability of blood and all of this, and poor infection control. These and many other factors can result in mismanagement of this procedure.
Thank you for bringing that enlightenment to us. How can training improve the surgical safety? What kind of training can we introduce to our facilities to improve surgical safety? And what can you say to clinics or hospitals in the grassroots area? How? Because I know that this is quite difficult for a lot of them because one, they don't have sophisticated infrastructure or supplies of resources. But tell us about that, and how can we improve surgical safety trainings?
Basically, it's important for us to be able to train the professionals and even sometimes be able to recruit non-professionals in the understanding of the procedures and everything involved. Now, when we talk about cesarean section, now the outcome of cesarean section is not only impacted by what happens in the theater. The preoperative preparation of the patient, if the people, the nurses, the caregivers are properly trained on things to do in the preparation of the patient, and training of lower level healthcare providers. Now, cesarean section, because of the poor resources in our environment, we might find out that in many developing countries, in the interland, you may not be able to have consultant obstetricians and gynecologists. And so you must be able to train some medical doctors in these life-saving procedures. But they cannot just be people who are very new, who are not properly trained, and then you deploy them into the field. Now, even if you are going to teach them in this life-saving procedure, they need to go through proper training so that they can be able to carry out this surgery safely for the mother and the baby. And then adequate training on post-operative care is very important, because a lot of time everything may go well intraoperatively, but the management in the post-operative period, because people are not properly trained, can destroy all the good works that has been done during the surgery.
Yeah.
So we need to get to be able to train different strata of healthcare providers and support staffs in the rural areas, in the interland, to be able to manage these procedures very, very well.
Yeah, thank you, Dr. Ajadi. While you were speaking there, I was just thinking, and I know there's a huge shortage of professionals and obstetricians currently in Nigeria and also in many low-income countries due to huge migration of healthcare workers to developed countries. So is this a factor to why a lot of these gaps? Because you see from Fatima's case, there was a huge delay as well. And also in the Kenya's case, sometimes there's a huge delay in maybe attending to women on time and also the post-operative care that you talked about. Huge delay, huge gaps in treatments that are leading to deaths.
That's true. That's true. This, you have just said it perfectly well. There is a lot of gaps because we don't have adequate manpower
Mm,
at the hinterland.
mm,
And because of this shortage, uh, it's almost always impossible to always get the professionals to be available
yeah,
as at when they are
we
needed.
need to need.
And one of the key factors that lead to poor outcome is delay in making the decision, the assessment that the surgery is, if the cesarean section is even needed.
Mm-hmm.
And that is a very key factor. We
Mm,
need to improve on our referral system
mm,
from the primary and secondary facilities
mm,
before we begin to talk about tertiary facilities.
yeah.
Now, many times women are undergoing labor and childbirth in the
Mm,
hinterland,
mm,
and some of them are actually being monitored by doulas and traditional birth attendants.
mm.
These people may delay for days before they refer this patient to the next center where they will get this interventional procedure. So there is a need to train nurses and these people in the hinterland to be able to detect early abnormalities in the process of labor and refer as soon as possible. If this is incorporated into our healthcare practices and services as nations in the African country and the third world, I believe it will go a long way in reducing the complications that we get from C-section.
Thank you very much, sir. Another topic I wanted to touch on, another point for discussion is infection control. What are some of the protocols for infection control during cesarean sections? Is there any one that you could enlighten the public on? Maybe some measures that you take within your own practice and you enforce within your practice?
Thank you for that question. First and foremost, it's important to establish that post-operative infection is a very serious issue that is affecting the outcome of cesarean section in most developing world. And
I think I've lost you for a sec, Dr. Ajadi. I think I lost you, Doctor.
excuse me,
I think I lost you there for a sec.
sorry,
I can hear you now. I think I lost you there, but you're back. I can hear you. You're muted.
sorry for that interruption. There was a network issue as
That's
part of the
yeah.
infrastructural deficiency that we suffer
Absolutely.
in Africa. So I was talking about infection as a major contributor
Mm,
to a poor outcome in cesarean section.
mm,
And you find out that for many women undergoing labor and childbirth,
mhm.
especially in the hinterland, the process of even the monitoring of the labor is very unhygienic. A lot of times, the vaginal examination is carried out with unsterile materials. And so they increase the risk of transmission of infection from the vagina to the uterine cavity. Now, that's one. The other aspect that is very crucial is the implementation of perioperative antibiotics usage.
Mhm.
This must become a firmly established protocol because this will go a long way in reducing the incidence of postoperative infection.
Yeah.
It's also important to educate the people on the need for sterilization of surgical instruments. Because of the poor infrastructure and availability in this environment, the truth is that in some local environment, instruments are not sterilized. They actually either disinfected through boiling or use of disinfectant. And this would not sterilize the equipment. And by that, there is going to be transmission of infection. Now, even the surgical practice itself, the use of unsterile materials it's very rampant in many areas of the developing country. So the need for adequate use of sterile procedure during the process of labor management, the sterilization of equipment, the use of perioperative antibiotics, and observance of standard sterile procedure during the surgery is
Mhm.
very important in reducing the incidence of
Mhm.
post-operative infection for
Yeah.
C-section.
No, I'm just sitting here and I'm thinking, why would someone use an unsterilized equipment in a hospital? Why?
These are some of the challenges that we are facing because don't forget that in a place like Nigeria and many other African countries, because many people are not rich in the hinterland, you have a lot of quackery going on in many of these places. And it is when the situation has gone very bad that these patients are now referred to the secondary center. And many times, because in these areas they don't have access to good hospitals, qualified doctors, these quacks are actually looked up to as doctors.
And then it also strikes me the morality of these people when we talk about health ethics. What are the
That's true.
morality of these people? Their conscience, virtue ethics, what people do and how they reflect on their practice. I think it's one thing we're going to do to speak to the public as a healthcare practitioner. Let's say even if they are quacks or they don't, it's in a local traditional place, there's something called virtue ethic where
That's true.
you can take ownership and have that responsibility, the duty of care to ensure that you are following some procedures, to ensure that your surgical equipment is at least clean, because this lack of sterilization is causing a lot of infection and is leading to death and huge deaths that we see in developing countries, and this is unacceptable. Also, I want to draw your attention to this question as well. Why, I know you've touched on this, but why is post-surgery monitoring critical? Maybe educate people, because I think some people do not have this understanding. Why is post-surgery monitoring critical for women?
Thank you. Well, three key factors in the outcome of any surgery is preoperative care, what happens in the theater, that is the intraoperative care, and the post-operative management. Now, everything that has been done before the patient is out of the theater can be completely destroyed by poor post-operative care
Mm,
because in the immediate post-operative period, that is a period where most complications do occur.
mm,
And very good monitoring, that is intense monitoring, should be the order of the day, should be what is practiced. Because with proper monitoring in the immediate post-operative period,
mm,
most complications can be nipped in the bud
mm,
and most abnormalities can be picked early and
mm,
complications can be nipped in the bud such that the major complication can be prevented and the
mm.
life of the mother and the baby can be saved. So it's important to educate that the whole idea of the outcome of the surgery does not end with the fact that the patient has just come out of the theater. That post-operative monitoring is extremely important because a lot of things can be going on, but once the patient is properly monitored, it can be quickly identified and the treatment and intervention can be taken and can be put in place and everything would calm down. So
Yeah.
when there is poor post-operative monitoring, a lot of things would go wrong.
Can you tell me quickly, what does it constitute? When you say post-operative monitoring, what are they expected to do? Are there guidelines to this? What will you expect your staff to do when they are monitoring somebody after a CS section?
Okay, a few things that need to be done. The first thing is the vital signs of this patient must be monitored
Okay.
closely. Now, if you have the facility for continuous monitoring, which many times is not available in many areas. But you can make the nursing staff to monitor these patient vital signs every 10 to 15 minutes for a period of 2, 3, 4 hours. Because if this patient is going to be having hypovolemia, any form of hypovolemic shock, this can be picked early and intervention can be made. Now, apart from checking the vital signs, it's also important to check sanitary towel that the patient is on to be sure that there is no excessive postpartum bleeding, because these are hemorrhage and these are things that can happen, especially after surgery. The patient is covered up. You don't know what is happening down there. Now, the nurses should be trained to monitor this towel perineal to be sure that the bleeding is not excessive. Also, it's important to educate them to check periodically at the operating site, the wound site, to be sure that there is no bleeding from that site. Also, another important thing that must be monitored is urinary output, because if a patient has bled excessively in the theater, the patient can go into hypovolemic shock and acute renal failure. And if these are monitored and the patient is noticed not to be having urinary output, intervention can be made and that can be reversed. An important thing as part of the vital sign is the blood pressure monitoring, because one of the indications sometimes for Caesarean section is preeclampsia. And then this patient went in, came out, but shortly after, because you thought everything is fine, the blood pressure starts shooting up and shooting up. But if that is not properly monitored, the necessary medications will not be given and the patient can go into full-blown eclampsia. So good monitoring in the post-operative period are a great outcome for both the patient and the management team.
Yeah. Everything you say, thank you, Dr. Ajadi. With everything you say, it points to infrastructure. I can hear proper infrastructure. A lot of these women are giving birth in rural communities and settings, poor infrastructure. And we cannot overemphasize the importance of having all of these facilities, birth attendants, in place for these sections and management of all of these treatment. Can you talk a little bit on the importance of having the right infrastructure or going to the right facilities to have treatment? Also, bear in mind, these are low-income countries and that sometimes this facility will not available. What can you say to policymakers, to government? What can they do abroad to help improve outcomes for women?
Thank you. Cannot overemphasize the role of the government and policymakers in making available infrastructure, because the outcome of everything that we are talking about, a lot is dependent on the availability of this infrastructure. Good electricity supply will make it possible for you to have proper sterilization of equipment. Electricity supply can delay none of cases where surgery was delayed for over 5 hours because there is no power supply. Even in a small cottage hospital, we are talking about a tertiary institution. So there is a need to invest in basic and essential infrastructure. Could not travel to the next health facility because of bad state of the road. So it's important for us to that government needs to invest in basic infrastructure and understanding that healthcare is actually an essential human right, and every woman should be the right to have their baby in safety, expecting that they will go in and come out. It's very important that government will invest in this and make facilities available for the populace.
Thank you very much, Dr. Ajadi. Like you've said, I agree with all your points. Caesarean sections are often preventable, and there are huge systemic failures on part of policymakers and government in developing countries that needs urgent attention. There are things that must be done urgently, and it's women's rights. Dying 82,000 women a day, one in 3 to 1,000 women dying in African countries due to mismanaged Caesarean sections that can be easily attended to. Skilled birth attendants, lack of staffing. These are things that the government can do to bring in, train and develop skilled workers, manage these situations better within the hospitals. A lot of doctors like Mr. Ajadi, I speak to a lot of consultants and doctors, are so disheartened at the state of healthcare. Many developing countries, lack of urgency with management of maternal care, and a reduction in maternal mortality not acceptable. Things needs to be done to make changes. I believe Jadi, even as the chief executive officer, I think these are things that he will agree with, and these are things that he is also working on and speaking out daily that needs to be done, so that our women can have better outcome. We're going to call on policymakers to support initiatives that improve surgical trainings and development. Even here in the UK, when there was shortage of staff in the United Kingdom, we can see mass recruitment from all over the world. The government can take strategic decisions to bring people to the country, to develop even people within the country, to train and employ staff within our clinical settings. And of course, we advocate for supply chain for surgical tools, sterilization, monitoring, care, and also we can help tackle these issues, to raise awareness like we are doing. So if you have your stories that you want to share with us from your practice, you have measures you are taking you to create an awareness, please contact leave the email at the end of the video. Contact us. If you want to share your stories, please contact us. In episode 8, we're going to look at traditional birth practices and medical misinformation. We're going to also explore maternal health and postnatal depression in different cultural contexts. Dr. Ajadi will come back again. I really enjoyed speaking to you, sir. Yeah, for all the hard work you're doing within the healthcare system in Nigeria and also out of the country. I want to applaud you. On note, I will ask you to make any final calls for action or your final remarks.
Okay, thanks so much for this. And for me, I think we all need a concerted effort to improve healthcare delivery for women in most developing world. Very disheartening, as you rightly said, that pregnancy be a thing of joy, but in most developing countries, it's end up being a thing of pain and sorrow for most women. All needs to be on deck. We need to improve on the facilities and also make the training and retraining of healthcare worker a very important aspect of governance in many African and countries. Our saying says health wealth. If the people are healthy, then it's easier for us to have a wealthy society. So please, I'll call on all people in the position of authority to please join hand with all of us and make sure that we push back these on unacceptably high maternal mortality and neonatal mortality that we're experiencing in many parts of Africa.
Thank you very much, Dr. Ajadi. And on that note as well, I'd like to also say to healthcare providers, clinical staff, to be mindful of their practices. And in low income settings, it's not always favorable, but there's a place for virtue ethics. There's a place of empathy. Try to do the right stuff. If you've been given a training, follow the procedure. Dr. Ajadi has laid a lot of ways we can monitor post operations care for women. Please do this procedure. And sure, with all of these we're doing, and if people are taking the necessary measures and the government is taking necessary measures to build infrastructure, and healthcare and practitioners are doing what is necessary, I believe that maternal mortality will be reduced significantly in countries. So thank you again once more for Dr. Ajadi.
Thank you for having me.
Yeah, bye-bye. Thank you for watching our Mother's Health podcast today. Remember, every mother deserves safe birth. Bye-bye.